Hi there. Welcome again to Halibbebsparentingspot, and welcome back to another random topic. We all know that every parent experiences the birth of a child in a different way, but postpartum depression does affect some parents. Most parents experience it without even knowing what they're going through, because having a child, it causes a range of emotions in one or both parents. Sometimes it's from excitement to depression. It typically begins within the first few weeks after delivery. Sometimes it may even begin earlier during pregnancy, or even later, up to a year after the birth of a child, depending on the individual. So postpartum depression, it isn't a character flaw or a weakness on the part of the parent. It doesn't mean that they are a bad parent, not at all. Sometimes it's simply a complication of giving birth. But if you have postpartum depression, prompt treatment can help you manage your symptoms and help you bond with your baby, because it often interferes with a mother's bonding with their child. And that bonding with your child is very, very important, because it is the initial connection that you create with your child. When a mother spends time with your child for the first maybe few minutes, the first few days, the first few months, just looking at the baby, wondering what a miracle you have, looking at their eyes, their hands, their feet, responding to their cries and trying to meet their needs. So some women will describe postpartum depression as a really strange feeling, but it is often hard to talk about it most of the time, but those strange emotions that pop into you from time to time, it is hardly the fault of any parent. It is always as a result of hormonal imbalances during that time. So some of the things that we should look out for in a new parent, and this is not to judge or criticize them in any way, it is mainly to understand and to be supportive towards that parent. Some mothers would, they may resent their baby. They may ignore most of their parental duties. Some of them feel sad, agitated, and not that they want to be like that. Remember that it is their hormones that is more in control at that time. So some experience really drastic mood swings. So it could be from sad to happy to angry and all the way to crying. They could be exhausted in 1 minute, and the next minute they're unable to fall asleep. They feel very, very restless. So I know a woman who actually abandoned her baby, but because she was from a community where people did not quite understand what she was going through, she was greatly judged and blamed for it. And she obviously did not receive the treatment that she needed. She didn't receive any support from her community. So she later on came back to see her child, to visit her child, to reconnect with her child. And my guess is that when she came back, her hormones were a lot more balanced. So some women can just start crying, and they themselves will not be able to tell you why they're actually crying. Sometimes it could be because the parent is experiencing the fear that she's not a good enough mother or good enough father for their baby. So other times it gets so bad that it could be hard for the mother to even remember basic things. So there could be a drastic change also in the parent's appetite. It could be like a drastic increase or a drastic decrease in their appetite. So new fathers can experience postpartum depression as well. It's not limited only to new mothers. They may feel sad, they may feel excited, they may feel overwhelmed, they may experience anxiety, and they can have changes in their usual eating and sleeping patterns. So it's almost the same symptoms that the mothers experience, that the father experiences as well. So there are a lot more symptoms that we should look out for, and it is not just after the birth of the first child, because the risk factors have a huge role to play as well. So it can be after the birth of a second child or after the birth of a third child. So encourage anyone you know who exhibits these symptoms to talk to a doctor, because if left untreated, it could cause a lot of emotional problems for the adults down the road, and even worse for the child, because a child living in that kind of an environment is really likely to have some serious emotional or behavioral problems. The child could experience sleep problems, eating difficulties, excessive crying, and as a result, the child may experience even language delays, because it will be hard when parents are experiencing postpartum depression. It is hard for them to engage with their child in a way that fosters positive growth and development. So I have been exposed to many cultures, and I really know and I understand how it goes. We're not here to tell you to forget about your cultural ways of doing things or your cultural practices. Instead, I want to encourage you to look at it as an addition to what you already know and what you already practice. And that is one way of actually having a growth mindset that we could transfer onto our children, that mindset. So as a community, this is actually where I'm going. As a community of parents and as a community of well-wishers, let's be more understanding, let's be more compassionate, let's be more empathetic, let's be more supportive towards new mothers and new parents in general. Let's speak to them calmly and ask them if they're okay. I mean, really okay. So there is no shame about it, and we need to talk about these feelings, because recognizing and acknowledging it is the first step towards getting help and support. So try not to overwhelm them with too many visits during this time. And truly, you do not need to be there for hours and hours on end. It is not fair to the parent and the baby. It is also not fair to expect them to entertain you during that time, because we do not know what their body and their mind is going through. And again, this has nothing to do with cultural practices. It is about being considerate. So instead, we should offer support in any way, especially to those parents that we know that they do not have any extra support at home. If you're visiting a friend or relative who just had a baby, go there to help them with one thing. Go there to help them to do the laundry, help them to do the dishes, help them to clean their house, bring them some nutritious food, offer to come over to even prepare dinner for them or to even prepare breakfast for them. Call that parent, call that mother, ask her what her favorite treat is. Bring her that treat if you can. Offer to run one errand for them, bring in groceries. Let the mother spend as much time with her baby as she needs. If you are a friend or relative that she trusts enough, she can leave you with her baby to go take a shower. That's a lot of support. The baby is not running away. you will get to a chance to see them eventually. So why the rush? Why the rush when they're just coming out from the hospital? Why the rush while they're still at the hospital? So make that mother feel visible, because most of the time it's so easy for us to get caught up with the baby, paying all the attention to the baby and ignoring the mother. So some new parents have actually have a hard time asking for help, even when they've spent countless nights taking care of your baby and staying awake. So let's start taking care of each other. Let's start looking out for each other, because having a baby is a very, very joyous experience that is at the same time overly overwhelming. So the one thing that we always forget as a community of well-wishers is that during that time, try your very best to keep your unwanted parenting advice and your unsolicited parenting opinions to yourself, just for that time, just so that the parent can enjoy, they can just really embrace that moment with their child. So thanks again for watching. I'll see you soon. Bye for now.